Bacteria and viruses can wreak havoc on the immune system, causing inflammation, chronic fatigue, and even infections. With the right nutrients, your body has the amazing ability to heal itself. I have used many natural therapies to support the immune system, but there is one therapy that is gaining a lot of attention, and we are going to discuss that and more today at Sunflower Shop. It's called ozone oxidative therapy. Joining me today is Dr. Serge Francois, Clinical Director and Nutritional Consultant at Vitality Health and Wellness Center in Southlake. Thanks for being here today, Dr. Francois.
Thank you. Thank you for inviting me.
So tell me, what is oxidative therapy?
Well, the ozone oxidative therapy, the way I would describe it is when you combine, when you infuse ozone into the bloodstream. As you know, that ozone is O3. Once you infuse that into the system, it breaks, and within a milliseconds, it breaks down into oxygen, okay? And that allows the heart not to function as hard once you have oxygen infused directly into the bloodstream. Once you infuse that into the system, it helps boost up the immune system as well, okay? And this is the reason that most of our patients that have had this therapy, after a few IVs, they become more energetic. They begin to sleep better. If they have even leg cramps, the leg cramps will go away, and so on, because no virus, fungus, or bacteria can live in an oxidative-rich environment.
What about healthy cells? Does it hurt your healthy cells too, or just the bad cells?
No, only the bad cells. And this is what's so interesting about it. It promotes apoptosis. Apoptosis is programmed cells death. It's not the same as necrosis or is the way it does it is not going to create any toxins with the system, okay? It does not create any toxin that is going to affect the immune system. It is a programmed cells death, and that is, then you have the lymphatic system that is gobble up all these debris to clean up the blood vessels. Now, what we're talking about here, what mainstream medicine will use bypass surgery or angioplasty, okay, with a simple IV that can open up the vessels wide up. Okay, this is the reason why we have so many patients that come to our office that have been suffering with angina, that was even scheduled for bypass surgery. After a few IVs, they no longer need bypass surgery.
So this helps people with colds, flus, anything with even autoimmune diseases maybe?
Even autoimmune diseases. We have several patients that came in with conditions that, that claim to traditional medicine that is incurable, such as Lyme disease. We have a patient, for example, with cirrhosis of the liver, and she was on the liver transplant list. After 3 months of treatment, she was no longer on the liver transplant list anymore.
This is helping people with Lyme disease?
This is helping people with Lyme disease. I would not say per se this is a cure for Lyme disease. However, we've seen a tremendous improvement with patients with Lyme disease.
So describe when a client or a patient comes into your office, how many IVs do they need a week or a day? How does this process work?
Well, each patient is totally different. We individualize the patient's care. Each patient care is totally customized. We do a total evaluation of the patient to see what will the best type of IV. We don't just do the oxidative therapy. We do a series of different IVs based on the patient needs and conditions.
Let me ask you this, heavy metals. I do a lot of paraanalysis, and I see a lot of people with high aluminums or mercury or even arsenic for some people. What kind of therapies can you do for that?
Well, this is what's different between the oxidative ozone therapy and chelation.
Okay.
IV chelation therapy. IV oxidative therapy is very effective for circulatory condition, whereby chelation, IV chelation, is very effective to remove heavy metal out of the system.
And you do that at your office too?
Yes, we do that at the office. Now, as you know that heavy metals turn the body into a free radical factory. And free radicals is been linked to hundreds of different diseases, maybe most diseases. First thing that we do, we recommend a hair analysis test to be done to see if they have heavy metals. We all exposed to heavy metals every day, every single one of us. And I cannot emphasize how important it is for every single individual listening to this video to get tested for heavy metals.
I know we share a lot of the same clients, and some of your clients have told me that you put them through a cleanse before they start the IV therapy. Can you explain a little bit more on that?
Absolutely. Just like I've mentioned before, not only that we're exposed to heavy metal, we're exposed to toxins. We have over 80,000 toxins, chemicals in the industrial world that we lived in. They add new toxins every day. One thing I usually recommend to all of my patients is a 21 days, a standard process 20 days purification program. Because not only that, it removes the toxins or the pathogens out of your system, then it provides you with proper nutrients in your system for you to begin to function, your body begin to function more of in a healthy state. We see patient blood pressure drop, we see sugar a regulated better drop, we see cholesterol drop. Of course, lifestyle changes and so on. A person, you cannot just do a 21-day cleanse and thinking everything is going to be fine. Okay, you have to have a lot of lifestyle changes as well. The way you eat. As a matter of fact, over 2,000 years ago, Hippocrates stated that let food be thy medicine, let medicine be thy food. And it's still true until today.
That's a great statement, Dr. Francois. Thanks for all the information today. I really appreciate you being here.
Well, thank you for inviting me.
To learn more about ozone oxidative therapy or any other health topic, come see us at Sunflower Shop, where great health is just a way of life.